You are taking tramadol, you are taking manpower and libido shaker to gather all the power so that you can last in bed.
I have never seen anybody receive a medal for lasting for hours.
How long should a man last in bed?
There's no such thing as duration because people's libido differ. 21% of youths have taken substances to enhance their sexual performance. Excessive consumption of alcohol.
Alcohol, that is a life changer. Doctor.
I would even say if you love yourself, don't even drink alcohol. I don't know if men are not talked to. It is very important to know what you consume. Because at the end of the day, for you to have a healthy semen, what you eat is very important.
What is the worst damage that drugs or pills would actually cause to a man's sexual life? She's complaining that I'm a 2-minute man. She wants me to last more than 8 hours in the bed. So you are taking tramadol, you are taking manpower and libido shaker to gather all the power so that you can last in bed. But have you sat down to ask yourself, what if you take all this just to last in bed and you end up lasting as an impotent man forever? Amazing people, I am always happy because I sit here every time to talk about real life issues, the one that will provide you with lasting solutions. And today I am back again. Make I come talk about this issue because already a serious matter for people's relationship in marriages. It is collapsing. If we don't talk about it, you can't hear it from anywhere else. So join us, the podcast that provides you with truth unfiltered. My name is Ekemine Ekwere. This is the platform. Uproot the Issue podcast is one name you should always have in your mind. It should ring very well. So if you've not actually subscribed to our channel, why not do that? We have a lot of interesting, life-changing, thought-provoking conversations coming your way. The society, Nigeria, shall be great. A new Nigeria is possible with you. So please, don't make Nigeria turn to Agamu, okay? So join the conversation by subscribing to our channel. So on today's conversation, we'll be talking about one pressing issue, which is the hidden link between drugs and a weak sexual life. The hidden link between drugs and a weak sex life. So do you think that drugs could destroy a sexual life? Do you think that all those pills you've been taking, all those trauma, all those manpower, all those things you've actually been consuming, those substances, do you think that you are safe? Because you want to prove to a woman that you can last for 8 hours in bed. Thank you for actually joining. Of course, in this talk show room, I'm so happy because every time I reckon, he always answers by his presence. The talk show room is one fantastic medical practitioner, medical doctor here that the state of Ukraine said, oh yeah, come, let's train you to become an excellent doctor. Precisely, he studied in Sumy State University, Ukraine, and graduated. He is a fantastic medical doctor practicing here in Nigeria. Now, global man, call him Mr. Integrity, call him the voice, the force that echoes truth, because he hates seeing you repeating a mistake or actually living as a victim of circumstances when Vivian is not in your circumstance. Dr. Ekemine Effiong is here in my midst.
How are you?
Doctor, I'm fine. You know, when I remember that you are my name, I'm okay. I'm fine.
As it should be.
It's good to have you once again, doctor.
It's a pleasure.
Okay, so doc,
Yeah.
let's start it this way. Because these children of Eve and children of Adam,
Okay.
they have been disturbing me with one question, and I would love to ask you, how long should a man last in bed? A normal man.
Is there anything like an abnormal man?
Because
The truth is that ideally, a man should last long enough to achieve orgasm.
okay, is
So-
it in duration or something?
There's no such thing as duration because people's libido differ. Do you understand? The libidos differ, and someone can actually handle a 1-minute man, and then someone can actually handle a 5-minute man. Someone can actually handle a 10-minute man. It all depends on who is involved and what is involved. It's a very complex, very complex, very, 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 very complex situation. It has a lot to do with the psychological part. If you're handling life issues is going to affect the turnout of of your sex and also the general well-being of the man
person,
involved. Yeah. But when it's now too long, we begin to worry about why is it lasting so long. Maybe ideally 5 to 10 minutes. It shouldn't exceed that, but long enough with the right intensity to achieve orgasm.
Okay, so
Yeah.
when we are talking about sex, meaning the goal of everyone
Yes.
that is into sex,
Yes.
orgasm is the goal. We should
Orgasm
chase the
is-
bag.
Yes, should be for pleasure.
For pleasure.
Yes.
Okay, so meaning that someone can actually satisfy even a 1 minute man.
Definitely.
Okay, that means you. Sorry, this is not to any offense. If you are 1 minute man, okay,
There's
there
hope.
is hope.
There's hope for you.
There
There's
is
hope
still
for
hope.
you.
Don't be hopeless, okay? There is even the 2 minutes. There is hope, and a doctor actually said that it's all depends on the kind of person involved. Okay,
Yes.
so that you will not be chasing the wrong bag. So you need to pay attention to how is the compactability like. But before we just get there, I would actually love to have this with doctor, because doctor, you see, many women, they have really been women, one thing I don't actually know, but I think it's your best place to actually, educate us here, because as a medical person, I mean, you have a lot of, experience, the expertise, meeting them
Okay.
every blessed, day. But then something must have pushed these guys into, let's outlive, or let's actually move beyond our length,
Yeah,
to ensure that
yeah.
we are not victim of disgrace, because it's so embarrassing how you have sex with any lady and she's reading newspaper, or she's going through something online, or maybe she's checking her phone for latest chats.
Okay.
So you will not become a laughing stock there. Now, doctor, you see, is there anything someone can take to last long in bed? Because when we are talking about the drugs and substance people do take here due to erectile dysfunction,
Okay.
is there anything someone can take which
Well.
will last the person long in bed? Let's know that we are living in the reality.
No, this is just from a realistic standpoint. There are a lot of things people take to last long in bed. But the main thing should be, for what reason? Why do you have to take this? That's number one. Number two, who asked you to take this? You understand? Because what do we call drugs? Anything that alters your normal state of health. Either you're sick and you're trying to correct a defect, or you are okay, you just want to be more okay. So yeah, there are a lot of things that can, enhance libido, enhance erection and all of that, but it has to be prescribed. You understand? It has to be prescribed. It has to be recommended by a qualified person. Exactly.
Yeah.
By a qualified person. So now I read some reports that about 21% of youths, teenagers, have in one way or the other taken substances to enhance their sexual performance. And this leads us to the big question. Why? A lot of factors. Peer pressure. Pressure from an experienced partner. Tension during sex. Lack of concentration. A lot of factors. Because even personally, when I get to talk to younger people, they're like, I don't think I'm lasting long enough. You've not even had proper sex. So what makes you think the duration is not enough? So it's a combination of so many factors. So yeah, there are things like that.
Okay, so doctor has actually established that fact,
Yeah.
because yes, we are good to go now. And doctor, there's something so fantastic you've said, the why, the factor, and which is what I would love us to talk about it, because yes, you see the teenage period, I mean that range, that
Yeah.
age bracket till you get to 29, which is the adult early stage of stepping into the man that everyone
Yes.
wants to see in you. It's a very tempting period for anyone, because that particular period is trial and error.
Yes, of course.
You can do and undo. So a lot of influences, a lot of factors, a lot of things, pushing you to maybe just try, and you find yourself in the error, opium, and getting yourself out is always, the difficult thing out there. There's shame and everything. But now, why because I want us to talk about the why now, those factors involved. And I want you to tell us, with being so real in life, why do these guys go this length just to satisfy a partner? Because you talked about, have you ever had proper sex? So let's know about that.
Exactly. So when we talk about the why, like I said earlier, peer pressure is one of the most important factors. A young man growing up from the adolescent age to puberty, being a teenager and being, a young man, so many changes, hormonal changes, occurs. And then you start noticing some things on your body. And most times, the society that we have is still not too open for, fathers to, because that's the first point of call, fathers to talk to their boys, or the boys to confide in their parents. And most times, too, they're stuck in the hostels and then they don't have the courage to talk to their counselors and all of that about whatever it is they have noticed. And then they will now have this conversation. I mean, we grew up in a different era where the mobile phones were not all over the place. Now it's everywhere. So it's very easy for them to access information. And then they get to talk to their peers, their friends about their experiences. They're like, so your own is just 5 minutes. Come, let me show you what you can take and be a real man. So it starts that early from the teenage years. And then with a country with little to no regulations about how drugs are being dispensed and all of that, it makes it even more difficult for us. Very, very difficult. So it starts with peer pressure. From peer pressure to, psychological issues, to they're trying to escape what they are facing. They're trying to escape tension. They're finding it as a way to just run away from reality. They're facing family problems and school issues and what have you. So it's more of peer pressure. It's more of psychological issues. And it's also more of, should I just say, trying to set personal goals, personal milestones, sexual milestones. Then exactly, more like I'm a man now, track records and all of that. And the most important thing that we've not mentioned, exposure to pornography. Exposure to pornography. So they don't understand it to the level that these porn actors, just like other movie actors, they're also acting. And a lot of them have been on drugs, different forms of drugs, to be able to overperform. It's a source of entertainment. So when a child is exposed to pornography early, they want to practice everything else that they've seen there.
And even surpass what they have seen there.
Exactly. So forgetting that there are damaging effects, to these things. So yeah, that's just it.
Whoa, because Doctor, that's one thing you've actually, the truth is that somehow we are in this era where parents now, and it's so, I'm so unapologetic saying this, parents now don't really pay attention to the screen feeds that the children, consume.
Okay.
What the children see, what the children get to, watch. Being on the TV, they don't even access what the channels or the social media platform or whatsoever the children are actually, what or the kind of friends the children keep. So you now see, children getting to watch certain things. And you see, especially those ones that are in 14, 15, they're hiding to watch some things.
Exactly.
And so they get on hiding certain things from the parents. And the parents, most of our parents now today, some of them, if they're actually seeing things now, some of them, and I can attest to this, most parents do not even know the kind of friends their children keep. Not to even talk of what kind of research. Now they say, one thing really funny about the phone. Now, the search engine on Google actually gives you a rundown, even on YouTube, a rundown of the previous things you've actually clicked or you've actually searched.
Yes.
Okay. So now parents don't even go through it's not about policing or it's not about controlling a child, but at least, perusing the kind of things your child consumes to the mind. So now most parents are even ignorant of the fact that some children do hide to watch porn.
Of course.
They are even ignorant of the fact that some children do hide or some children do have, oral sexual pleasure and communication, interaction on WhatsApp and on Facebook.
Exactly.
Oral sex.
Exactly.
They don't. And some parents don't even know that somehow their children as well have been indulged, have been, taken or dragged into some kind of homosexual and homosexualism and lesbianism going on even in the dormitories. So it's something that our parents should. I don't know if it's I don't actually know how they should go about this, but I feel parents should. It's now time for them to sit up, look at what the children, because the truth is, before we move to this stage, we will definitely pass the teenage era.
Definitely.
There's no way you can. I've not seen someone
you
just going up to
escape it.
the adult, the adult stage like that overnight. So you need to pass this trial phase of your life where you face a lot of peer pressure. And most of them, I wouldn't really blame them. Most of them is as a result of, the kind of, they say evil communication corrupts good manners. The kind of conversations they have. So let's just say you have a conversation with a friend, maybe you that is experienced, you may talk about, the number of girls you've nagged, the number of girls you've, So how do you expect someone who maybe for some reason may not really have that, and sincerely can just open up, I don't even know, I'm innocent too. I've not even tried it before. You know me, normal man, now you're not a real man.
Yeah.
Come, let me show you how you can go about it. And they will be lured into the whole thing. But not an excuse. The main issue here is that, this is really happening. And I've loved the fact that you establish that point very clear that this is actually, happening. And so, Doctor, I would, love to, touch this other aspect because, yes, I come to realize that it's not really about the tramadol or the cannabis or manpower. Even in our own era, I think some of them do take these bitters, Aloma bitters and all those things.
Okay.
Still to stimulate the erection. So that some of them do smoke.
Yeah.
And so they feel that before, before sex, you should be high, be in that spirit, be lifted to that cloud 9 before entering the cloud 10. So now, to those that smoke or to those that, smoking, because this comes some kind of substance abuse, this smoking.
Exactly.
So now, smoke, to those that smoke, tell us how, smoking destroy the sperm cells. Okay.
So before we even get to that, talking about Google as a search engine and how you can even see, search history. Now, Google also has the private parts. The parts that when you switch to the private mode, you get to key in certain words. If you close the browser, you won't see anything again by the time you open it. It automatically clears out. So I think parents should just be more vigilant, to be very honest. A lot of parents, maybe for some reasons, work, economy, whatever the situation might be, they've lost touch on true parenting, which involves being part of your child's everyday life. From the choice of friends to the things they consume online, especially with the advent of tablets and mobile phones, with internet access, they should be more vigilant. I'm sure they're looking at this and they will definitely understand what I'm talking about. Because back then for us, before you get to where the computer was, it would take you a little while. And there were some things you could actually not search because of those restrictions. So I think parents should be more involved. And then talking about consuming smoking, it's very complex. It's really complex. Now, it is not only tobacco. It's cannabis. As much as cannabis is not legal here, but I doubt if there's any neighborhood you will walk into in Nigeria of today and not perceive cannabis. The cannabis itself is very addictive. It's something you can almost not leave when you start smoking. But now I'm more concerned about the other things they add to cannabis to smoke. The artificial THC, the component that makes you high in cannabis, that's been fabricated in the laboratories now, and they are added to the cannabis itself to, increase how high you're going to be. I'm more worried about it because some of these things have not passed through any form of, checks, any form of, standard screening,
standard screening,
and all of that, and they're already in circulation. Now, they come in different names, which some of us have heard it on the streets before. The cannabis is coming in different grades, from the Arizona to the moon rocks to whatever you'd call it. Now, we don't even know what these kids are consuming. Some of these components have never really been checked in the lab. What can they do
to the body?
Look, as a young man, it is I don't know if men are not talked to. It is very important to know what you consume. It is very important. What are you taking in? Does your body have the capacity to eliminate it? Where does it go to? Is it going to the kidney? Is it going to the liver? Is it going to the lungs? Is it going to the brain? You have to know what you're taking in. Because at the end of the day, for you to have a healthy semen, what you eat is very important. What you consume is very important. Smoking in its entirety has never been beneficial to the human race. It has never been. Exposes you to cancer, exposes you to all the things you can imagine. So how much more smoking substances that has not been verified? Tobacco is bad. So many countries have kicked about tobacco smoking. Marijuana is bad. We have to tell ourselves the truth. More and more research have been conducted, and it is tied to infertility. So how much more cannabis that has been potentiated by laboratory, fabricated chemicals, then your entire reproductive health is in danger. So more legislation should be made towards, the consumption of cannabis. Parents have a very huge role to play. We came from era where a random elder can caution you on the street.
Yeah, I know,
and that
now.
it doesn't happen now.
It doesn't happen now.
And slowly we are becoming those elders. Give us the next 20, 25 years, we are already elders. So how much more elders that smoke weed?
The Pablos.
The chief Pablos. So how are we going to do? So we have a very huge role to play. A man's reproductive health is tied to so many things. It's not only when you have semen, the sperm cells, are they actually healthy? You understand? So when we do semen analysis, we look out for a whole lot of things. Motility, shape, quantity of sperm cells. So an ordinary person doesn't know the difference between semen and sperm cells. Well, that's a story for another day. So smoking puts you at risk of infertility.
Sorry.
And you've seen the records now that infertility is on the high side as the day goes by. So it's tied to so many things, including what we take in. Yes.
So, doctor, this is really, really, shocking, because we are in an environment where the intake of these substances gets high every blessed day.
Exactly.
So when you talk about substance abuse, we also, it seems like the conversation is also, really, really tilted towards the male aspect. But let's get to the female wing as well, because whether the woman is not fertile or the man is impotent, the case is that there is still a ripple effect that it will play on the long run.
Yeah.
So now, talking about you as an expert is here, you've seen several cases in the hospital, several reports coming in. But what is the worst damage? The worst damage that drugs or pills could actually cause to a man's sexual life?
What can be worse than infertility?
Sorry.
When you're young, you think everything is going well. And on the average, men are the most stubborn set of people to treat clinically. For you to even get them to the hospital for regular checks, so just say, Baba, nothing is wrong with me.
Are they all right?
Are they all right? Even sometimes for their wives to bring them for... An average Nigerian man can live for 30 years and not go to the hospital. That's the truth. It's very difficult to get a Nigerian man to go to the hospital, except the very enlightened ones, that see the need to do that.
Yeah. So
by the time they come in, a lot of things have gone wrong. I'm talking about pills. What could be worse than infertility? When you're young and wild, it's very easy to, lose focus. And at the end of the day, when you get to realize this, it's already almost too late.
Sorry.
Like I said, as a man, it is important to watch what you consume. It's not even about pills. Alcohol itself. Excessive consumption of alcohol.
Alcohol, that is a life changer. Doctor, life changer.
Alcohol itself.
My people, but it's life changer. Am I lying?
Alcohol has over the years been tied to impotence. It has been tied to erectile dysfunction.
Doctor, start right now.
It has been.
He's helping life.
Exactly. It has been tied to infertility, excessive alcohol consumption. And now we have fake alcohol, proliferation of fake alcohol into the system. So you can just be here thinking you're drinking Jack Daniels, but it's just manufactured under the bridge.
How?
Exactly. I have not seen clinically, I've not seen any direct benefit of alcohol to the man's body. I have not seen. I would even say if you love yourself, don't even drink alcohol.
Now, doctor, people, they will die.
They won't die.
How would they survive?
They won't die by surviving. So there's no direct benefit of alcohol. Not to talk of pills. I know a young man that takes pills before his girlfriend shows up. So over the years, he has been dependent on pills to enhance his sexual function.
Wow. That's low self-esteem.
Exactly. So he can't even achieve erection on his own. I know also a young man that has to watch porn before his girlfriend arrives. So he tells me that the porn sets the mood for him.
His mood swing.
And I've known him for the longest. He's been doing that since his teenage years.
Jesus.
So now his erection is tied to watching pornography. So these are the issues that we have. Like I said, the terminal end of this thing is infertility or impotence. That's the worst thing that can happen to a man. Knowing that you've married your dream wife, you have your dream job, but to have a child is now a challenge. It's damaging psychologically, it's damaging physically, it's damaging culturally. Because the moment you marry in Africa, you start counting days. You've been married for 1 week, what is happening?
Okay,
You've been married for 1 month, what is happening? I say his wife should be pregnant by this time.
Online in-laws.
And the system has a way of not looking into the man, but looking in the direction of the woman. That's the issue. That's the worst that can happen to any man. Impotence or infertility. Either of them. Erectile dysfunction that we're talking about, At a point, your body has so much been dependent on these pills. There are so many of them flying around. There's hardly any motor park you go to today that you will not see somebody hugging something or hawking something, in a sachet. And be like, the moment you take this one.
Libido.
There was a time I wanted to travel and a young man came to my window. I like sitting close to the window. And he was like, Oga, let me give you manpower. He brought out some containers and concoction was inside. He told me, if you take one shot of this, I guarantee you 6 hours, your penis is not down. I told him, I don't need a 6-hour erection. What am I using it for? I have never seen anybody receive a medal for lasting for hours. So these are things that slowly destroy our lives as men. Men need to start talking to each other.
Like we are doing now.
Exactly. So the worst thing that can happen to a man after excessive consumption of pills, concoctions, herbs, whatever you call it, is impotence and infertility. Nothing will pain you more than seeing another man do your job.
And doing it well.
He will definitely do it well because he's doing it to spite you. He's doing it to spite you. So that's the worst that can happen to just any man.
Oh, doctor, the conversation is really interesting because you've actually hit 2 points that I got so straight and I don't want to miss them before coming to, 2 other conversations before we call it a wrap. And that is the aspect of the society Because somehow I feel, and I would love you to come in, and I want you to really dwell on that.
Yeah.
Because somehow I see that when the drum now rolls to the side of the man, we are really, really fair. But when it gets to the side of the woman, it seems we are actually punching or throwing blows at the woman, forgetting that this is also a human. Mostly, I feel that somehow, for me, I feel that the society is not doing justice to the humanity, especially the aspect of women.
Okay.
The society is not being fair with women. Because when it comes to the African society, some practices, when it comes to how we address certain issues, when you talk about for a woman to be barren, you see how we carry the whole thing, and we may even, mostly from the families, we pressure the man.
Yeah.
What are you doing with a woman that is barren? Oh, God, go and take another woman, marry the woman. The goal is to have a child. But when it gets to the man, and I feel it is very, very, I've really not seen, and women, I really give women, a lot of sense out there, because there are women that will rather, accept the blame than to expose that the woman is the cause.
Okay.
Because I've not seen situations where the woman, the wife, knows it vividly well that the husband is the problem, and she comes out openly, sincerely, to, publicly, shame the husband, because of course that is a shame in the first place. Yeah. She would love to do what? To wear that shame and fix it upon herself that, maybe she is the reason why this man doesn't have a child by this time. 4 years in marriage, 10 years in marriage, and the calculation still goes on, because the family they know. In fact, they are really, really good in the mathematics. The math that they failed in nursery school, they are actually doing that in marriage today. So now, doctor, I would love you, to enlighten the society out there, because the stigma is really so high on the women when it comes to the problem of fertility.
Okay.
Who should be blamed?
Okay.
Should we push the blame every time on the woman, and should we drag the man as well? Let's know what the problem is in marriage.
So the thing about infertility and fertility, it has to do with two people. One person is the giver, one person is the receiver / carrier. So most of this infertility or barrenness thing that has been pushed to women are unverified. They have not been verified. They are not doctors. They are not nurses. They are not qualified, therapists or reproductive health specialists.
They are online doctors.
They are just online. They are just offline in our communities, in our villages, in our churches, just judging from afar. We've had cases of people coming in to do fertility tests, and we realized that the man was the issue. You understand? We've also had women being the issue, but they've not been verified. So the African society thinks that whenever there's no child in a marriage or in a union, that the woman is the problem. In most cases, it's not. It's not. Male infertility is on the rise. The records have shown it. Being tied to so many factors, to stress, heredity, certain things we consume, like what I said earlier on.
Yes.
And lifestyle. If you hold some of the young men around here and say they're wearing so tight boxers that is squeezing
the whole choncho inside.
It's squeezing it. And that is dangerous for reproductive health. Nothing should squeeze your testes. The testis is supposed to be suspended. It's supposed to be free. Nothing should squeeze it. Cutting off blood supply.
So all of them wearing condom boxers, those tight ones.
We are in trouble. They are in trouble.
This is serious.
Everybody is in trouble. So we don't have the moral standing to, push the blames to any gender. And to be very practical, it's none of our business, except you're a healthcare provider trying to render help. And most cases, they come to you if they find you, fit enough to handle whatsoever the situation is. So all those things being pushed towards the women are unverified. They're not very certain about where the problem is coming from. So I'd even advise couples to go for a fertility screening before marriage. The earlier, the better. Certain issues will be identified on time. If it's low sperm cells or whatever the situation might be, it will be identified on time. And, appropriate, qualified persons will look into ways of improving health and alternatives if need be. But that's just my take on it.
Okay.
Yeah.
Doctor, you've actually, stressed that point because that was the fact. In fact, one thing that is actually bothering the African society is when it comes to gender issues like this.
Yeah. It's always the woman.
The main thing is actually tilted towards the woman. There's one other thing that actually you actually said, which I said too, but that has actually slipped my memory at the moment. I feel I will definitely go back to that when it comes back. So now, doctor, to the aspect of infertility.
Yes.
Because people will think, somehow we've actually been casting stones at the crystal glasses.
Yeah.
And we've been throwing more stones towards the wrong doors. So now, anything that will happen now, in fact, in our setting, we blame village people even more than the problem itself. The problem is always the village people.
Okay.
We even have this. In fact, somehow I feel that it is only in Africa that witchcraft, the witchcrafts are really suffering.
Yeah.
Because any small thing now, he fought.
Exactly.
They are blamed 247.
Exactly.
So now, doctor.
Yeah.
Is infertility as it is it spiritual or is it as a result of these pills we've been taking over time? Because this aspect of not being able to have or impregnate a woman, they say, hey, why not take him for prayers and deliverance? Yes, that is the word I was looking for.
Okay.
They need a special deliverance, they need a special prayer session. We think they can deliver the man, they can turn a man to be potent.
Okay.
But then do you think it is spiritual or any spirituality, any prayer, any deliverance can deliver such man?
Okay, so as a scientist and as a doctor, it's very difficult to defend spiritual matters. Very, very difficult, because when you look at things, I mean, it's almost impossible to defend anything spiritual. We cannot see, we cannot confirm. But when you come to us to the hospital, series of tests are run, X-rays and scans are conducted. We get to identify things very early. There was a young lady that had a very huge uterine fibroid. And then she went to some spiritual persons and they told her it's pregnancy. So she's like, I've been pregnant for the last 3 years. Which, under normal circumstances, that is not even possible. She was so brainwashed that she said, Doctor, don't tell me what I know. I'm even coming here because my husband insisted. If not, what am I doing here?
A prayer house.
So you understand. So the more you dig into the spiritual aspect of things, in most cases, the more confused you become. So we cannot, as scientists, defend, the spiritual standpoint, but we can always say it medically. A lot of people are going through things they are yet to discover because they've not been to the hospital. They've not tried to consult an expert on it. And it becomes frustrating for them. Hence, they fall back to the spiritual aspect. You understand? So I'm of the opinion that you should not talk to anybody about your health challenges except a doctor or a qualified healthcare provider. That is when you get proper guidance. The moment you start talking to random people about it, one, confidentiality is breached. Number two, you might probably never get the response that's appropriate. Number three, lifestyle is part of it. Like we talked about, lifestyle changes. The things we consume. Young people are taking too much pills. Whether to prevent pregnancy or to enhance sexual performance, young people need to slow down.
Make them calm down.
They need to slow down. They just need to slow down. They need to slow down. If you have problems achieving or sustaining erection, as you're supposed to, then you need to talk to a professional about it. We are the only ones that can prescribe it the way we're supposed to prescribe, the way your body can tolerate, and we'll know when to discontinue. That's just my take on it. So I can't defend the spiritual part of it, but I can defend the medical part of it. Because that's the one I see, that's the one I'm trained to know. Yes, exactly.
Okay, doctor, you see, because this whole thing, I mean, the erectile, dysfunction and the whole man would standing, rising, falling. It's something that, yes, the aspect of what actually can stimulate or cause the manhood or the prick to stand is what I want us to actually discuss now, because someone, I think I saw in one of the other podcasts where someone was saying that a man, what you should actually think of now is financial orgasm. because someone that is after money, or someone that is thinking about how to make money, will not be, the prick will not be standing 247. And that was crazy. So but it's very realistic.
Yeah.
So for some people that maybe the prick is not standing, it is for the other ones that is standing too much. Is it normal? Because it's something that we really need to understand.
Well,
It's, something of erection and how we have the dysfunction of erection. Please just enlighten us on that.
Talking about the erectile dysfunction thing, inability to achieve or sustain an erection. Maybe you actually have the erection, but it's not rigid enough, or you're finding it difficult to kickstart. Like I said, it's a complex thing. It has a lot to do with so many things. Could be the psychological part. Maybe you're under stress, under pressure, or you're facing some personal issues, life issues, death of a loved one, and all of that. Can also be from a religious standpoint. There are certain religions that forbid totally sexual activity before marriage. And you can be heavily penalized for that. So now having to cross over from that orientation to trying to have sex too can be challenging. It can also be from medical line. It can be from the medical standpoint, certain medical conditions. It can also be that you have been sick for a while and you were given some prescriptions, antihypertensives, the anti-diabetics and all, and you've been on it for a very long time. They are known to cause erectile dysfunction. Exactly. So if a man has erectile dysfunction, it has to be diagnosed by a doctor first of all.
So that we confirm.
So that we know there is actually an erectile dysfunction, not self-perceived erectile dysfunction. No, go to the hospital with your complaints. Let it be diagnosed. The person that diagnosed would definitely refer you to the appropriate, person to handle the condition. So you shouldn't self-diagnose. You shouldn't self-medicate. And don't be your own doctor. It takes a whole lot of steps to become a doctor. So don't be your own doctor. Exactly. You are the doctor. It's still you that is the pharmacist. It's still you that is the therapist. Yeah. Some persons just need to be on some medications for a while. You understand? Some persons just need to be on therapy for a while. Some persons just need lifestyle, adjustments. Some people need to trace to the root cause of the erectile dysfunction. Might not even be the sexual part of it. It might just be some medications you are on, for an underlying disease condition. And then that can be sorted.
Okay.
Yes.
So, doctor, you've actually covered a lot.
Yeah.
The lifestyle aspect, what you need to adjust, the aspect of alcohol, just taking in as much taratla, as much smell of, and anyhow you want to drink it, but then there is a need to cut the whole consumption process. The number of bottles, if you've been taking 10 a day, you need to reduce it gradually. I don't know if you can do without it, but I feel that with time it will turn into something that maybe you just need water instead of alcohol. And the aspect of always taking pills, okay? I know it's aspect, one part of self-esteem, because I know low self-esteem could cause that. I will not be, one thing, there's something men detest so much as when a woman laughs at. When you become the next topic in the WhatsApp group. so it's really painful. So you need to, or maybe if you're someone that brags.
Exactly.
Once I catch you, I will deliver. And you are the one now being delivered.
Maybe it's someone that matches.
So the woman will know this. I thought you were bragging. I thought you said you can do
Alpha.
this. Okay, alpha now. Why is it falling?
And then you're overly excited and this whole thing now collapses because the penis has a mind of its own.
Oh, I didn't.
So that comes into the psychological standpoint.
So,
you make noise too much and it's time to walk and
you're not performing. So it's just a whole lot about, erectile dysfunction, and everything boils down on what are we taking in every blessed day.
Yeah.
Okay? So men out there, be so watchful of what you take in. That is just for me, but doctor would have just something to inject before, he's a doctor, he has a syringe. From his words, he will going to inject it and it will be instilled in your body. But just before we leave, doctor, please, I would love you to, because whatsoever, this is something that marriages have, have actually collapsed today due to certain mistakes we would have avoided long time ago, years ago, before we even got into it. So now, doctor, in marriage now, we see a lot of things happening. For purpose of confidentiality, most of them may not, come out here to open it to the public. Oh, this is what is going on.
Yeah.
Because marriage is the only nonsense tolerating institution that you see a lot of rubbish and shit, but you need to do what? Swallow it for the, purpose of preserving what you guys started, and for the purpose of avoiding public shame. Because the stigma with standing or actually facing the society is one particular problem that, most marital persons face. So now, doctor, do drugs, because when we are talking about in our own ibibio prof baby so now when we are talking about the men, we also should actually infuse the women in the conversation as well, so that we have a balanced view at the end of the day. So do drugs, because I feel men is not only men that take this thing. I've seen a lady blowing ice professional, in fact 10 times better than the guy. And you'll be wondering, what kind of expertise is this? She didn't go to school to learn it.
Yeah.
Lifestyle, like you've said. Peer group, like you said. So now, they may be doing this at a very tender age, growing up, flexing the youth life, being the baby girl. And this is the same person that will be married. This is the same person that will be called a wife. This is the same person that we expect to be a mother. Not a mother of one. Mother of at least more than 4 or more than 2, as the case may be. So now, do these activities, which is the drugs or the intake, will it damage the womb?
It depends on what is being taken in.
Okay.
Most of them don't have the direct damage to the womb. They damage the hormones that you need to get pregnant, the hormones that you need to sustain pregnancy, the hormones that you need to live normally as a woman. So they affect either the secretion or distribution of those hormones. So the womb itself might not be directly damaged, but if those hormones that support menstruation, supports pregnancy, supports, conception and all, if they are altered chemically, it will be very difficult to conceive. Okay. So the effect is not directly on the womb itself.
If it's in the hormone.
It's alters the supply, the distribution, the production of these hormones.
So can you set an example? What kind of, for example, for eyes like this, which aspect of the hormone in the woman?
The truth is that most of these things, they go into the bloodstream. You understand? Either they're metabolized in the liver or broken down in the liver, and they get to be supplied to the brain. The brain controls everything else. So the moment the brain is unable to send certain signals the way it is supposed to be sent, that's where we have problems.
Oh.
Exactly. So any recreational drugs are dangerous. It's not something people... Don't even test it and see what it will be like. You might test and not be able to quit. A lot of times. It's better you don't try than try and then you're looking for ways to quit. But even if you've been in it already and you're trying to leave, then you need to seek professional help. That's the truth.
Okay.
Yeah.
So there are a lot about things that are going on in the society, a lot about marriage, a lot about relationship. Everything now boils down on what do we take. And that is what we've been sitting here over the past minutes you've been listening to this podcast to discuss the hidden link between drugs and a weak sex life. So some of times, couple of times you get to see how people complain, my man is not satisfying me, I'm not satisfying my wife, I'm a 2-minute man, I'm a 1-minute man. And you'll be asking yourself, who actually, established, or which constitution, where do we even have that you need to be this aspect of a minute man, this minute man, before you would satisfy a woman? It is really, really, it's amazing, and it's sometimes, very, very, curious, because we need to ask, or we need to answer the question now. And that is why this conversation is really, really necessary. The problem of the whole thing not standing or falling at the same time, or the womb, the problem of infertility, a whole lot about impotency. Why marriage is actually collapsing today is as a result of certain issues like this. If you can't provide any child for any woman, or if you can't, impregnate a woman, it's always a problem. And the family too will be affected. The society will now be throwing, down drops, a whole lot of things that you may not really, really withstand as a person. So this has been a fantastic, rewarding conversation time with Dr. Ekemini.
Thank you.
And if you are meeting this for the first time, you actually you are a victim of this, maybe low self-esteem for some issues, or the other, you feel like you can't actually satisfy a woman, you are a 2-minute man, the stuff is not standing, it's not right, it's not falling, it's standing too much, 247, no problem. It's never too late. There is always a need to seek a professional help. When I say professional help, not going to those in plaza that are shouting buy for libido enhancers. No. We have, therapists that are really, really ready to help you out. We have medical practitioners like Dr. Ye. We have people that have been trained to offer this kind of professional services, and not just roadside, and patients that you can just run into for help. So, doctor, before we just call a wrap, please, your last word to first the young person watching this and to a married couple. Yes. No, as a single, you can still do it.
See, to the young people there, it's better you don't try these drugs.
Okay.
It's safer if you don't even try it. There's nothing you are supposed to do concerning things you don't understand. Don't try as much as possible to prove a point.
I want
you
to
understand?
Arrive.
Be properly guided. And then for the married people and people intending to marry, it's better you do a drug test and fertility tests. It's very important. The earlier you do it, the better. Thank you.
Okay. Don't try what you cannot do what. You got it very clear. And before you get married, please, drug test and fertility test is very, very necessary. It was a fantastic and a rewarding talk period about the issue of drugs and how it will affect your sexual and reproductive health. So if you've not been performing well in bed, you won't last as an impotent man because you listen to this podcast. Don't do that here. Don't mention. We are not here to mention. And we listen, we never judge. Thank you so much. It has been rewarding with you. I love you because I can't stop loving you every single minute. Bye-bye from South Nigeria. I remain your evergreening podcast host, Ekemini Ekwere. Until next episode.